malnutrition, disease, spending on health, all linked to the need for a better sanitation in our living conditions. As Swachh Bharat becomes a national priority and buzzword, we at NDTV, along with Dettol, in our campaign Banega Swachh India, will track the ground realities of health in this episode and highlight the challenges as well as bring you an insight on an issue that impacts each one of us. The Swachh Bharat Abhiyan is not just about cleanliness. It is also about healthcare. We'll also tell you about all the vector-borne as well as waterborne diseases that people are prone to because of filth, dirt, unhygienic living conditions, as well as poor sanitation.
76 million people in India don't have access to safe water. Over 146,000 children die every year from diarrhea caused by unsafe water and poor sanitation. 37.7 million Indians are affected by waterborne diseases annually. 774 million people in India live without adequate sanitation. 50% malnutrition cases are linked to infections, including chronic diarrhea caused by a lack of safe water, sanitation and hygiene. India is home to 48 million stunted children under the age of 5, the highest in the world. This is the reality of countless villages in India. Terrible living conditions, filth and a complete lack of sanitation. In rural Madhya Pradesh, the battle against malnutrition becomes a losing one. Poverty coupled with an unhygienic environment. "16 kilometers away from Sirsod, this is the health center of Karera Tehsil. Every bed is full. Many others had to be turned away. Dozens of patients, all suffering from diarrhea, a common problem in places where water quality and sanitation are poor. 3-year-old Gudia's case is typical. Dehydrated, she was brought here to be treated for diarrhea. This is when the doctors realized that she was also acutely malnourished and sent her to the Nutrition Rehabilitation Center. Naryani says that they have got used to living with sickness and disease.
गांव में गंदगियां रहती हैं, मच्छर रहते हैं, मक्खियां रहती हैं, इसलिए बच्चे कुपोषित होते हैं और धूल मिट्टी में खेलते हैं, इसलिए होते हैं कुपोषित।
When we talk about Swachh Bharat, the provision of clean drinking water is the key to maintain public hygiene and health. The practice of open defecation and contaminated drinking water leads to a host of waterborne diseases like cholera, typhoid, hepatitis, jaundice and diarrhea.
One condition that we are increasingly concerned with is cholera, which is it is a waterborne disease, but it's also it's an acute diarrheal disease as well. And this is very, very closely linked with contaminated water as well as food sources. And again, as an organization, WaterAid believes that in order to respond to cholera, it's important to have your mainstream health interventions like a vaccine as well as treatment of cholera. But you also need to have really important water sanitation and hygiene measures.
Shocking images which may seem even more frightening when they are captured not from rural areas but from the nation's capital. Sangam Vihar, Jagdamba Camp, Gita Colony. People living in absolutely abysmal conditions, surrounded by garbage, mosquito-infested filthy water, open sewers, filth all around. Sheila lives in Gita Colony. She tells us that she's admitted her 2 children to hospital because of diarrhea and vomiting. This is the children's 3rd visit to the hospital in a month.
शीला देवी, आपके यहाँ बच्चों को क्या दिक्कत आई थी?
उल्टी लेटरिंग हो रहा था और डॉक्टर के पास ले गए, वो बोला गंदगी की वजह से हो रहा है, उसके दवाई चला।
तो क्या को आपकी बेटी अस्पताल में?
हाँ, यह मेरी लड़की थी और एक लड़का था वो वाले।
तो फिर कितने दिन अस्पताल में रहे?
लड़का तो 1.5 महीने रखे।
1.5 महीने?
हाँ।
More testimonies on the filth and squalor in yet another settlement in the capital.
कम से कम महीने में 2-3 बार तो हो ही चुका है। बार-बार क्या होता है ये तो नहीं उतना समझ में नहीं आ रही है। तो गंदगी है, अब तो पता ही है जो कूड़ा कबाड़ा का काम है,
ये तो होते रहता है। फिर लैट्रिन बाथरूम तो है ही नहीं, अब दूर में भी जाना पड़ता है। बस इसी हालत से ये बच्चे को ज़्यादा दस्त पड़ता है और बुखार बीमारी भी होता है।
Here's where it gets even more alarming. This vicious cycle of malnourishment and disease can be fatal. There are new studies that are showing a link all the way from bad sanitation to environmental enteropathy to children being shot. In fact, India is the country with the greatest number of stunted children. Lack of hygiene, clean drinking water, as well as sanitation is the major contribution to malnourishment.
When children have like these repeated infections, repeated diarrhea cases, repeated soil transmitted helminth infections, the entire gut, the intestines, that entire lining changes, and as a result of which its ability to take in whatever nutrients are going into the body is reduced. So chronic, prolonged and severe diarrhea and infections results in a condition called stunting, which means that for a child's age, that child is not as tall for that age, so the growth is restricted.
Besides waterborne diseases, India faces pressing health issues with vector-borne diseases. Malaria, dengue, chikungunya, worm infections and Japanese encephalitis affect many Indians. Common risk factors are unsafe water, sanitation and hygienic practices, which adversely affect health and the well-being from infancy through adulthood.
So firstly, about neglected tropical diseases, Amika, this is a huge area of concern. About 149 countries across the world are being affected by neglected tropical diseases. The larger challenge is places where there is a lack of hygiene, lack of sanitation, lack of clean water. This is where neglected tropical diseases actually grow from. And the bigger challenge is that while we talk about sanitation, it's also important to think about the environmental sanitation, the environmental hygiene, because if the environment is not clean, the problem of neglected tropical diseases is that they actually grow through infectious vectors meaning mosquitoes and flies, etc., and also infected animals like pigs. So the challenge really is, how do we ensure that the environment is clean so that we can get control on these diseases.
Vector-borne diseases account for more than 17% of all infectious diseases, causing more than 1 million deaths annually. According to the Ministry of Health and Family Welfare, 27,879 cases of dengue have been detected this year in the country. Over 560 people died due to the disease in 2014, 440 in 2013, and 519 in 2012. Many of these diseases are preventable through informed protective measures. Vectors are living organisms that can transmit infectious diseases between humans or from animals to humans. Mosquitoes are the best known disease vectors. Others include ticks, flies, sandflies and fleas. Open garbage dumps by the roads, polluted water bodies and poor sanitation make public places a breeding ground for pests and other insects.
See, vector-borne diseases are basically either mosquito-borne diseases or some other insect, which may be sandfly, which transmit kala-jar, or maybe ticks and mites. Important vector-borne diseases in our context, in Indian context, is malaria, dengue, chikungunya, Japanese encephalitis and lymphatic filariasis. These 5 diseases, which are covered under the Directorate of National Vector-Borne Diseases, are mosquito-borne diseases, and kala-jar is a sandfly transmitted disease.
According to national figures, around 40,687 cases of chikungunya have been reported across the country till date. There has been a spike in dengue cases every year. Till October 30, 2016, 79,800 dengue cases have been reported and there have been 166 deaths. Mohammad Salim, an auto driver in Delhi, describes how his 15-year-old daughter battled for her life.
मेरी बेटी को खुद डेंगू हुआ था मैं ऑटो चलाता हूँ। 15 दिन मेरी बेटी को डेंगू में एडमिट रहा गया, जो कि 15 दिन मैंने 1 रुपये नहीं कमाया मैडम, क्योंकि डेंगू का प्लेटलेट मेरी लड़की का 20,000 पे पहुँच गया था, जो कि डॉक्टर ने बोला कि अगर इससे कम होगा तो ब्लड का इंतजाम करना पड़ेगा। तो लेकिन वो ऐसी नौबत नहीं आई जो उससे नीचे। लेकिन 15 दिन मेरे जो बेस्ट गए, 15 दिन में मेरे घर का खर्चे का हालात आगे से पीछे बढ़ गया, वो हो गया।
Monsoons, there's stagnation of water. With stagnation of water, there's breeding of mosquitoes. In this season, we certainly see a spurge, an increase in number of patients coming for whether it's vector-borne, whether it's mosquito-borne, whether it's water-transmitted diseases.